Hello. Audible? Sonia ma'am, you are here. Are you able to hear us? Uh, Kindly unmute yourself. Yeah. Yes, your mic is muted. Yes. Are you able to hear me?
Yes, I can hear you.
Yes. Good evening, ma'am.
Yeah.
And good evening, everybody. Let's begin, right? Good evening, everybody. I'm Narendra Kumar Pankaj, Director, CEO of HealthCrum. Today we are having Dr. Sonia Naik from Max Hospital, and this is HealthCrum webinar. Well, HealthCrum is organizing various webinars since lockdown. We were working closely with the government of Pradesh, and we were helping various patients, various callers who were having various confusions regarding COVID-19. And again, welcome you all in our new series of HealthCrum webinars. And it is the only platform giving end-to-end personalized healthcare assistance. We are all serving individuals and corporates with personalized support and care in 24 states and 600 plus locations. We at HealthCrum makes individual and their dear ones free from worry of remembering or collection of health related stuff. And we talk about ROI of healthcare that nobody does. Hospital is a place which provides treatment to sick people around the clock, and medical staff works 24 into 7 tirelessly. But still getting the right treatment at right is always necessary. Hence, with the doctor support, and we comes here to support you to take correct decision. As healthcare is focused on quality and healthy life of the individual over the price. In continuation with this, we had collaborated with India's leading hospital, which is having 2,300 plus leading doctors, offering treatment for 29 specialties with a network of 12 full-fledged hospitals and 5 other medical facilities. And that is none other than Max Healthcare. Next 2 months, we will be having the different specialities of doctors talking about their specializations, solving your queries, and the various myths regarding current COVID situations. As the webinars are not one-way process, hence at the end of the webinar, there will be question and answer session where you can put your questions. And if you have any personal doubts, then we can also arrange a separate session of yours, right? You can also watch the live webinar and ask questions at HealthCrum YouTube channel, right? So I request you to all subscribe that. And don't forget to like and subscribe our Facebook and Instagram pages as well. So today we are having Dr. Sonia Naik, Director and Head of Unit, Max Super Speciality Hospital, Saket, and they are having multiple specialized locations. Few more introduction about Dr. Naik. She has done MBBS from Bhopal University, Madhya Pradesh. She is a MD of Obstetrics and Gynaecology from Pandit Jawaharlal Nehru Medical College, Raipur. And she has been awarded with for organizing Secretary Fetal Medicine. And she was also editor Bulletin of Fetal Medicine Society. So here we have Dr. Sonia Naik. Handing over to you, ma'am.
Thank you very much. A very pleasant evening to everybody. And all of us are actually, um, uh, wait, I'll just share my screen and then we'll start. Can you see my screen? Hello? Can you see my screen? Is my screen visible? Is my screen visible?
Yes, sir, we can see your screen.
Okay. So
Yes,
we
yes.
are all going through a unusual pandemic, which I think generations have never actually have never witnessed it, and we've been one of the generations to witness such a pandemic, and the changes that the pandemic has brought into all our lives in various ways. And all of us have been actually discussing so much about COVID these days that we've forgotten what are the other problems that each one of us is actually facing. And some of us are actually in the denial phase. Some of us are not trying to get in touch with the medical community for these things, because for everybody's COVID has become so important that we have just left our non-COVID things aside. And these are the few things that I would actually bring forth to your notice, that other than the COVID pandemic that we are all taking care of, or actually not taking care of, we are actually dealing with it in a very appropriate way, whatever best that everyone can do. We also have to think about the rest of the things which are actually important and which cannot be ignored, and which are not so important, and we can just leave it for the time being till the pandemic is over. So, what is important, what is not important? It's very important to know all these things. So now, and we are all staying vigilant, and we are all staying safe. And I would advise you also to keep yourself safe and vigilant. Be vigilant for the next 1 year at least. Don't panic, but at the same time, stay safe, stay vigilant. That's the main thing. And the main important thing to stay safe is your mask. So masks are most important thing, and a good mask. It's not just covering your face and your nose with anything, but wearing a proper appropriate mask is the most utmost important precaution that each one of us can take. So this I wanted to bring forth to your notice, that this was um, basically one of the patients actually wrote this when she left the hospital. So this was when the COVID was at its peak, when there was a total lockdown in March, April. So this was a pregnant patient who had delivered, and she had written that I went from weeks of pent up anxiety about what COVID-19 could do to my pregnancy and unborn baby, to a sudden state of bliss and gratitude. A life in the middle of all this darkness brought with it hope, which changed us all during this tough time. So we have had, so pregnancy is like a second birth for a woman, and we've been having deliveries during this complete COVID pandemic. And it's not that we've been not that these pregnant ladies or the babies have had any problems. We've been actually tiding over through this phase with utmost precautions, and giving them the best experience whatever possible that can be. Now we all know that our best defense is prevention. Wash your hands often, don't touch your face. So when you have your masks on, don't try to touch your masks in the front. Try to hold your strings and pull it down, but don't touch it in front. Okay, so that's very important. I mean, it should not be that you want to actually scratch your face, and on top of the mask you're scratching your face, or trying to touch your nose with that. Basically maintain a distance. That's very important. Exercise again, keeping mobile, keeping yourself well hydrated, is a very important prevention to for avoiding the risk of blood clots in pregnancy. And eating healthy, balanced diet, enough folic acid, vitamin D supplementation, avoiding alcohol, drugs, and smoking is again really important during pregnancy during this pandemic. So basically, it's not just the pregnant ladies that I'm talking about of living it up during COVID crisis, but we all of us are working at home or we are working from for home, and we've had this advantage of not only just work from home, but work at home and work for home also. We've all had this opportunity, once in a lifetime opportunity, and uh, of having work from home with additional things like work from home, work for home also. So basically, we have been able to give more thought and more action to our food and exercise. And on the contrary, I meant everybody thought that everybody will gain weight during this pandemic, but we've actually seen in our medical community that in our patient group also that everybody's been able to give more attention to the food and exercise and have actually taken care of their weight, BMI, in a very nice way that most of the people that we come across have actually lost some amount of weight and have been able to achieve a good, appropriate BMI. So there's been more time to connect with the family. We have never got this time. We've been able to actually have this time to connect with the family. More time to organize yourself, your surroundings. So many of the people have gone into gardening and the kitchen work. So basically, more time to organize yourself, surroundings, and your support. So, the pregnant ladies, the most common question is what effect will coronavirus will have on my baby if I'm diagnosed with the infection? Everybody is scared of getting a COVID infection. Everybody. But most of all, the pregnant ladies, because over here there are two beings. There's the mother and the baby. So it's not just that the coronavirus will affect the mother. Over here, the mother is also scared. What will happen to my baby if I get corona infection? So, till now, there is no evidence to suggest an increased risk of miscarriage or any increased risk of birth defects if the mother gets COVID infection. It's unlikely that if you have the virus in any trimester, it will cause any problems with your baby's development, and none have been observed currently. So, there have been no extra birth defects that have been observed. There's no problems with the growth also that has been observed or any risk of miscarriage that has been observed if the mother gets a COVID infection. But there are some reports which are emerging that suggest that some women can go into preterm labor or premature, they can have a premature leaking, that's a premature rupture of membranes, who had this infection during the third trimester. But this is true of any infection during pregnancy. It's not just for COVID infection. If the pregnant lady gets infection of any sort during pregnancy, any high-grade fever during pregnancy, she's always at risk of preterm labor, premature leaking, leading to premature labor and premature baby. So this is true for any infection, not just of COVID infection. So as of now, for any pregnant ladies, we haven't come across any problems to the baby in terms of birth defects or miscarriages or growth. So over here, rather the mothers have had the opportunity to create a better connection, not just with the family, but with the baby also. So bonding with a baby to be can be as natural a part of your pregnancy as hormonal changes and weight gain. Indeed, a recent study indicates that these early connections can have a lasting effect because memory starts developing in the womb in the babies. So therefore, bonding, the mothers have had the opportunity to create a better bonding with the baby. Tummy touch. You probably find that your hands automatically gravitate towards your belly, whether to rub away the discomfort or the soothe the tiny ripples inside. It's such a beautiful, amazing feeling when a mother says that I've had, I felt the movements for the first time. And she describes in various ways this particular feeling. Playing music, musicologists have actually seemed to agree that these rhythms, similar to the mother's heartbeat, have the most calming effect. And low frequency sounds cross the placenta best. Babies will even react to the rhythm of a drum beat. Talking to your baby, it's not just touching the tummy, making the baby listen to the music, but talking to your baby. But the second trimester, your baby develops the ability to hear. And what the baby listens to most often is your voice. And moments after delivery, when I got to hold him, so this was one of the patients who said that moments after delivery, when I got to hold the baby for the first time, I said, "Hi, baby." And the baby seemed to look at me with a clear expression as if to say, "So you're the face that goes with the voice." So basically, take time to relax. Your mood reflected in such physical signs as your heart rate, hormonal levels, breathing pattern influences your baby to be. And just sitting quietly or focusing on your breathing is a way to de stress and connects the mom. And as the mom becomes centered, steady, let her baby know that all is well. Take out time to reflect on the person to be. So basically, whatever the mother thinks, what the mother surroundings are, everything is reflected in the baby. If the mother is disturbed, the baby will be. So if the mother is disturbed because there's a COVID pandemic and she's always in an anxiety phase or a panic phase, the baby also actually carries on with that message that there's something wrong with my mother. So therefore, relax, take precautions, take all the preventive measures, wear a proper mask if you're going for your any antenatal checkups, if you're going for your any ultrasounds, but at the same time, don't miss all these. So, what effect will this pandemic have on my childbirth choices? Will I need to wear a face mask when I'm in labor? Yes, you will be wearing a face mask when you're in labor. So, throughout labor, sometimes the mother says that I need to breathe properly. I'm not able to breathe, and therefore I'm not able to push down properly. So, we'll give you a mask which is more roomy and in which you can breathe properly. So, but you have to wear a face mask because you are actually inspiring more, expiring more. So, there's more exchange of gaseous exchange during when you are in contractions. So therefore, so that you don't breathe in any unhealthy environment outside, or I mean, everything is made sure that everything is fine, but anybody can be in a career state anywhere around. So hospitals and all take precautions that every doctor, every staff, everybody is tested properly when they come on duty, but still you have to be careful yourself. So it's a preventive aspect, preventive measure that you're taking for yourself, not for the rest of the people in the labor room, but for yourself. Protect yourself, wear a face mask when throughout in labor. And will I be able to have my birth partner with me during labor and birth? So over here, we allow the birth partner with you during your labor and birth if the partner is also tested for COVID. So whenever you're getting admitted for labor and birth or for any admissions in the hospital, you're always tested for COVID. And in case the birth partner is allowed, the birth partner is also tested. But at the same time, we are restricting the number of people that are allowed with you even if you're coming for a delivery, only one person is nowadays allowed. So will I be able to have my birth partner with me if I'm induced? Yes, you will be allowed. So the birth partner can be there throughout with you if you're induced for labor. Because after induction, you might take even 24 hours. Will he be allowed or she be allowed in case if you have a cesarean section or instrument delivery? No, nowadays we are restricting really the number of people when we do any surgery, even the staff in the operation theater, when we're doing any surgery. So the birth partners are not allowed into the operation theater these days, because even the number of staff that when we are doing the surgery are always restricted. We have minimal number of staff these days in the operation theater. So it's important that you maintain your mental well-being during the pandemic. It's very, very important. So there is an anxiety actually of COVID infection. There's an anxiety of not having the birth partner during delivery. There's an anxiety of social isolation. There's an anxiety of not having parents or proper family support, of reduced finances, on having something missed important on some virtual antenatal visits. Along with the anxiety, there's always a fear, there's a confusion. Initially, yes, I would say, when we just started with this pandemic, nobody was sure as to what measures to be taken. So there was a fear, there was a confusion, there was anxiety. But now, after having faced for almost like a year now, everybody is now acquainted well with all the precautions, all the safety measures, and everybody is given a best birthing experience. So this was again another patient who said after delivery that as I sat afterwards in my room alone with my baby, I felt peaceful and safe. Coronavirus was out there in the world, but in my room, there was no threat of it entering, thanks to everyone's excellent adherence to the rules. So we've been taking utmost precautions at Max Saket for the delivery. This is the only hospital wherein the COVID uh, patients, the COVID patients are kept in a separate building, not just a separate floor or a separate designated area, but a building which is separate from and at a distance from the main hospital. So our building, which houses the labor room, the delivery room, the NICU, is at absolute safety with almost all the precautions, safety precautions that are taken for the mother, for the staff, for the partner, whoever is there, and for the baby. Now, other than the delivery, so over here for the pregnancy and delivery, one point which is very, very important, other than the delivery, I've been talking that is the pregnancy part. Don't So most of the visits, quite a few visits we are doing online now, and we also encourage the patients to take online visits if a physical visit is not really desired. But that doesn't mean that you miss on to important ultrasound, miss on to important investigations, because during pregnancy, if we say that this investigation is required or this ultrasound is required at 12 weeks, it means 12 weeks, because at 12 weeks, we need to find out certain things which are very important to rule out any genetic problems. If you want to do an ultrasound at 16, 19 weeks, it actually means 16, 19 weeks because we want to rule out any birth defects. So there's certain important things which are in pregnancy done at important weeks, and we therefore ask you to do it at that particular time. So please do it at that particular time. And in case we ask you for a physical visit, do a physical visit, because we probably want to monitor your baby's growth or monitor some important measures in you. There'll be most of the tests are being done nowadays by home takeaway methods. So by those this thing Max Home Care, you can call it, or any other home this thing you can call it, for the lab tests, and you can get it done. But for the investigations and for certain physical visits, we do call you, and you need to come at that particular uh, in those particular days only. So please don't miss on to your important investigations, because it's very important pregnancy. As far as delivery, yes, everybody is now becoming more a little less anxious and little less fear, as because they've realized the important measures that the hospital takes. Now, after delivery, what about the contraception? Now, this is something which everybody thinks that, oh, it's something that it's not important, we need not discuss. But this is something which can be very easily discussed online. So if in case you need to know about contraception, about family planning, just fix up an online appointment and discuss with the doctor. Emergency contraception, the doctors are available 24 hours. The hospitals are open 24 hours. So if emergency contraception is required, please go forward and discuss. Again, an online appointment is You can always have it. And if the doctor wants to come, please do come and get yourself appropriate measures. There are the pills available, then there's intrauterine devices available, implants available, and all these can be done. I mean, it doesn't take any time for all these measures to be done in the hospital, because hospitals are giving appropriate time, appointments well spaced apart so that there's no crowding. So contraception is again very important, and most of us can deal with it by online appointments. What about prevention of gynae cancers? This is something which preventive measures we all know now because of the COVID, that prevention is so important. The utmost safety measure that we all have realized with the COVID is the masks. We all now know that there's nothing important as important as prevention and safety. So now, prevention of gynae cancers, there are people who have been actually very diligently following the prevention of gynae cancers, their checkups, their pap smears, their regular routine ultrasounds, their mammograms. But during this COVID pandemic, if in case it's one of your routine regular visits that actually can be deferred, so there's no problem. You can defer it for a few months. But then there are patients who have a very high family history, strong family history of gynecological or any other cancers like breast cancers. In those patients, we've already waited for a year with this pandemic. So now waiting for more than a year for some of the people who are high risk population should not actually now miss on to their important investigations, which are important, like the pap smears, the ultrasounds, the mammograms. Some of the mammograms and ultrasounds are advised to the patients on a yearly basis. Pap smears is 3 years. If your previous pap smears are normal, you can easily wait for 1 or 2 more years. That's not a problem. But for the ultrasounds, for the mammogram, for those at risk population, they should get it in time. Now, do not wait for more, because it's already been more than a year. Now, what about the other gynec problems? Now, we have had people actually waiting. If in case they've had any problems starting in March, April this year, with any postmenopausal bleeding, or with a lump in the breast, or with any other lump, or with heavy bleeding, abnormal uterine bleeding, they were just waiting. They were just waiting. They were hoping that pandemic will pass away in 1 month, 2 months, 3 months. It hasn't, even after 1 year, almost. Now it's going to be 1 year. It started in December in China, and it's going to be 1 year now. It still is there for the next few months, still more. So it's important that we report these problems whenever they happen. And at least take an online appointment, report it to the doctor, discuss with the doctor. In case the doctor feels that ultrasound is required or physical examination is required, please go forward and do it. Don't ignore such problems. So the most common problem being the abnormal uterine bleeding. Abnormal uterine bleeding means heavy vaginal bleeding during periods or in between periods, or the period bleeding continuing, or in case you're having intermenstrual bleeding, like your periods come on time, but in between there are some days in which you have abnormal irregular uterine bleeding. So any of these prolonged uterine bleeding, heavy vaginal bleeding, intermenstrual bleeding, they're all come under the common term abnormal uterine bleeding, and they need to be reported to the doctor, and they need to be investigated. Especially the postmenopausal bleeding is very important. If you've not had periods for a year, that means probably you're menopausal. And after that 1 year, if you've had any episodes of bleeding, that really needs to be reported urgently to the doctor. That requires an urgent ultrasound, an urgent examination. So postmenopausal bleeding is something which needs to be reported urgently. Any abnormal vaginal discharge, whether it's foul smelling or it's persistently itchy or scratchy, or associated with any local lesions like boils or lumps or any swelling in the local part, they need to be reported, because we need to see actually to figure out what sort of infection it is. It's a fungal, it's a bacterial, it's a protozoal. That we can only tell you after we have seen you. There's no common blanket treatment for these vaginal discharges or swelling. Any acute pelvic pain or any persistent pelvic pain again needs to be reported to the doctor. Any urinary problems, like we've had people calling us up, oh, we seem to be having a UTI because I seem to having burning and pain while passing urine. We give sometimes, okay, once or twice we do give them antibiotics without any investigations, but then repeatedly, if you're having all these problems, please report it to the doctor. It's important because then we need to do a proper culture, need to do an analysis. Why is it happening repeatedly? So these are the common issues which one needs to report. So, as I told you, most of the visits during this pandemic are virtual visits, but physical visits, when desired, have to be attended to. So, don't miss on to your appointments, even though they are virtual appointments. Don't miss on to your tests and the weeks mentioned. Discuss your diet, your exercise, emotional well being during these virtual consultations. Physical visits for essential ultrasounds and tests, and also for vaccination. So vaccination also, don't miss on to your important dates of vaccination. And it's also recommended that you get a flu shot. The flu vaccine won't protect you from COVID-19, but it will lower your risk of catching the flu, which very commonly gets, nowadays at least, which very commonly gets confused with the COVID, whether you're having the flu or whether you're having the COVID. Now, in a brief, talking about uh, the things that we have for the gynecological investigations and the gynecological treatments at Max Panchsheel. So, as you know, that we all have a dedicated pregnancy setup at Max Panchsheel, the ultrasounds, the the examinations, antenatal checkups. Except for the delivery, we have the ultrasounds and the gynae checkups and the non-stress test. Then the termination of pregnancy for the some of those desiring by medicine, and that also under anesthesia. Management of the miscarriage if somebody is having a threatened miscarriage or a repeated miscarriage, and surgeries for the ectopic pregnancy. So the laparoscopic surgery is done for ectopic pregnancy management, and and it's usually a daycare surgery which can be done at Max Panchsheel. Then we other preventive gynae checkups. Yes, we have the entire radiology support, the ultrasound, the mammogram, the DEXA scan. Then about the daycare surgeries, the gynecological surgeries, DNC, that is the scraping of the lining of uterus, that is available there. Hysteroscopy, that means the endoscopy of the uterus. Doesn't involve any cut. It can be done without anesthesia. So we call it as a office hysteroscopy, which is the only center in North India at Max Panchsheel that it is available. So it's like a walk-in procedure. You just come in, get a hysteroscopy done, see what is there inside the uterus, which is causing the problem. And most of the times we also see and treat it. Like we do office hysteroscopy. If there's a small polyp or small growth, we take it out at the same time without any anesthesia. So office hysteroscopy is available. Laparoscopy for infertility. There are people who are not able to conceive, and for them, laparoscopy and hysteroscopy, which is a daycare procedure, is available at Max Panchsheel. Surgery, laparoscopy for endometriosis. If it's a endometriotic cyst or there's mild endometriosis, mild to moderate degree of endometriosis, the surgery is daycare surgery and which can be done easily here. Then a small fibroid, a small to moderate size fibroid, which can be easily again removed, and it's a daycare surgery, laparoscopic surgery, which can be done at Max Panchsheel at the daycare center. Cryocauterization of cervix, which is just a 5 minutes procedure. Warts removal, which is a 5 minutes procedure. They're genital warts. Then cryocauterization of the cervix, that means there's a raw area on the cervix which requires cauterization, freezing of the cervix. All these procedures, they are daycare procedures and they can be done at Max Panchsheel. So these are a few gynae procedures that I want to talk. So nowadays, most of the gynecological procedures are done laparoscopically, except for a few of the malignancies and the deliveries, which we don't do it laparoscopically, but we majorly 90% of the gynecological procedures are otherwise done laparoscopically. And quite a few of them are daycare surgeries, which can be done at Max Panchsheel. So this was the entire information that I wanted to give actually during the COVID pandemic.
Ma'am, we have one question
Yeah.
uh, from Miss Bhagwati Priya. She is asking delivery issue in with COVID pregnant women, and what is preferable, cesarean or normal delivery?
So during the pandemic, it does not change the route of delivery. A cesarean or a normal delivery, both can be done. I mean, we are equally. So this is, you're asking about a person who is having a COVID infection or just a pregnant patient who comes during the pandemic?
No, she's asking about COVID pregnant women.
COVID pregnant women. So,
Yes.
COVID pregnant women also, we are not giving a very prolonged trial of labor, but certainly she can have a normal delivery. We've had patients who have had a normal delivery with COVID infection. So, it's not necessary to do a cesarean. But at the same time, we are careful that she is not in labor for too long, or in case whenever we feel that there is a need for a cesarean section, we do a cesarean section for these women. But certainly, one will not give a very prolonged trial of labor in these patients. And none of these high risk patients who get COVID infections are then given a trial of labor. They are done a cesarean section.
Thank you, ma'am, for answering. Viewers, you can also ask your questions. You can use chat box.
So I think, I mean, over here, basically, I mean, we want to highlight that preventive, nobody should miss. I mean, you can always defer your preventive checkups if in case you just going for, I mean, it's just a routine checkup and you're not a high risk population, you can always defer it. But those at high risk for any particular problem or a malignancy should not defer the preventive checkups also now, because it's already been a year. Any problems like any common gynecological problems should be reported to the doctor. So they should not be. Actually, all the doctors are available online, so you can always take an online appointment and at least consult with the doctor, and the doctor themselves will tell you that who I mean, whether you need to come to the hospital for the checkup or for any investigation or not, because even we are actually trying to hold on to the number of patients coming to the hospital. We are restricting by the number of people coming to the hospital. So only we are calling those whom we really feel that they need to come to the hospital.
Thank you, ma'am. Another question is coming
Any
from
risk
Ankit
in
Sharma.
feeding the child?
He is asked.
No, there's no risk in feeding the child in COVID. So if in case the mother is has COVID infection, she is required to feed the baby. So she wears a mask and she feeds the baby and she burps the baby, and then she keeps the baby at a distance of around 3 meters. But the feeding continues. So,
Okay. This was very vital information. People doesn't know even how far they have to sit or how long they can uh, keep a distance from a child. So
yeah.
that was
So over
very,
here,
very
I mean, we don't allow the child to be there in the cot with the mother. We always want the baby to be kept in the crib. The crib is at a little distance from the mother, and but the mother definitely feeds the baby, and the mother is always there with the mask in the room with the baby, because you can't make the baby wear the mask, but the mother can definitely wear a mask.
Yeah, in this pandemic, we were also getting various cases, wherein one case was a lady was asking us, she got COVID and her maid is also having COVID, and her parents are very old. Now only one person who was not having COVID is her small child. So how to deal with this situation?
Yeah, everybody has
So
to wear a mask.
yeah, yeah, yeah. Okay, so that was very, very informative webinar, ma'am, and it was very well, very good webinar. And I hope people who have joined, they are getting benefited, and there are many viewers with YouTube channel as well. So if they or any of them get any question, so we will contact you, ma'am, later on, and we can also take a online appointment for the same.
Sure.
Sure. Thank you so much, ma'am, for
Okay.
being with
Thank
us.
you.
Thank you.